We've all been there, right? That ache, that stiffness, maybe even that sharp, shooting pain in your neck. It's one of the top reasons people end up going to the doctor. But what's really going on in there? Well, today, we're going to dive deep into one of the most common culprits, cervical disc herniation. You know the feeling. You wake up and you can barely turn your head. Or you've spent all day hunched over a keyboard, and now you've got this deep, nagging twinge. But what happens when that pain doesn't go away? Or worse, when it starts to feel like a lightning bolt shooting down your arm? That's usually a pretty big sign that we're talking about something more than just a simple muscle strain. And hey, if any of this is sounding a little too familiar, you are definitely not alone. This is an incredibly common issue. But here's the good news. For the vast majority of people, this is a problem that's really well understood and, more importantly, very treatable. So to see how, we first have to understand the incredible piece of engineering that is your neck. To really get what can go wrong with our necks, we first got to know what right looks like. So let's pop the hood and take a quick tour of your cervical spine. Okay, so picture this. Your neck is basically a stack of 7 bony building blocks. We call these vertebrae. And slotted between each one of those bones is a soft, squishy, cushion-like disc. These little guys are absolutely crucial. They're the shock absorbers, and they're what give your neck that amazing range of motion. Now, let's zoom in a little closer. The easiest way to think of one of these discs is like a jelly donut. Seriously, it has this tough, fibrous outer ring, that's the dough, which is called the annulus fibrosus. And inside, it has a soft gel-like center, the jelly, or nucleus pulposus. And trust me, this whole two-part structure is key to, well, everything. So you can probably guess what a herniation is, right? It's when the jelly squishes out. A little tear or a crack forms in that tough outer dough, and the gel-like center pushes its way through. Now, when that little bit of escaped jelly presses up against a nearby nerve, that is when the trouble really starts. And what's really interesting here is that not all disc problems are created equal. You can see here there's a difference. A simple bulge is kind of when the whole donut flattens out, like a tire losing a bit of air. But a true herniation, that's a focal problem. It's one specific spot where that jelly breaks through the dough, and it can range from a small protrusion to a more serious extrusion. So the big question is, what causes this to happen in the first place? Well, it's almost never one single thing. The reality is it's usually a combination of factors all playing a role together. For starters, just plain old aging and our genetics set the stage. Then you can pile on lifestyle factors like smoking or obesity, which can speed up that wear and tear. And then there's the big one for so many of us, biomechanics. Repetitive movements or just being stuck in one position for too long, yep, we're talking about tech neck. Just think about it. When you're looking down at your phone for hours, you're literally squeezing the front of that jelly donut, pushing the jelly backwards. A sudden injury can be the final straw, for sure, but it's often this slow burn from all these things combined. Okay, so with all these different potential causes, how in the world do doctors figure out exactly what's going on? Well, it's a pretty methodical process that usually follows 3 key steps. It always starts with your story. What you're feeling, when it started, what makes it better or worse. That's the patient history. That's followed by a really detailed physical and neurological exam, where the doctor's looking for objective signs. And only then, if it's still needed, does imaging like an MRI come into the picture to actually see the disc and confirm what they suspect. This is really how doctors start to tell the difference between simple neck pain and something more specific. The classic telltale sign of a disc pressing on a nerve is what's called radicular pain. And that's that sharp, electric, shooting pain that travels from your neck, down your arm, and sometimes all the way to your fingers. And this is where the real detective work begins. You see, each nerve root that comes out of your neck is in charge of the feeling and muscle power in a very specific part of your arm. It's like a roadmap. By using this map of dermatomes for sensation and myotomes for muscles, a doctor can literally trace your symptoms right back to the probable source in your spine. It's pretty amazing. So check this out. For example, if you've got pain radiating down to your thumb and you feel some weakness when you try to bend your elbow, a doctor is going to immediately suspect an issue at the C6 nerve root. Or what about pain in your middle finger and trouble straightening your arm? Well, that points directly to C7. Your specific symptoms create this unique fingerprint that helps identify the exact culprit. Okay, listen up, because this is really, really important. While most cases are definitely not emergencies, there are some critical red flag symptoms. Things like new problems with your balance, or suddenly feeling clumsy and dropping things, any issues with bowel or bladder control, or any weakness that's just getting worse and worse. These signs can mean there's pressure on the spinal cord itself, and that requires immediate medical attention. All right, so after all that diagnostic work, let's talk about the best part, recovery. And I really want to stress this. The most important message here is that the outlook is overwhelmingly positive. Just let this number sink in for a second. Over 85%. Get this. That's how many people with a cervical disc herniation get better within about 2 to 3 months without needing surgery. The body has this incredible ability to heal itself. So, how does that recovery happen? Well, treatment usually follows a very clear, staged approach. As you can see in that first stage, everything starts with conservative care, modifying your activities, maybe some heat or ice, and physical therapy. Now, if symptoms are still hanging around in that 6 to 12 week window, the next step might be stronger medications or targeted steroid injections. Surgery is typically a last resort, really only considered for those with disabling symptoms that just won't improve after months of trying everything else. This quote really sums up the whole goal of treatment. It's not just about covering up the pain. The real objective is to reduce that inflammation around the nerve. You do that, and it calms everything down, which eases the pain, and ultimately it restores your function so you can get back to living your life. So when does surgery actually get put on the table? Well, it's reserved for some very specific situations. First, if any of those big red flag symptoms of spinal cord compression show up. Second, if there's clear evidence of progressive nerve damage. And third, for that small group of people who have disabling pain that just doesn't respond to months and months of comprehensive conservative care. So let's circle all the way back to the main takeaway here. Look, getting a diagnosis of a cervical disc herniation can be incredibly painful, and frankly, it can be a little scary. But the key message, the thing to really hold on to, is that the prognosis is excellent. With a proper diagnosis and a patient-staged approach to treatment, the vast, vast majority of people recover fully. And that kind of leaves us with one final thought. Pain, numbness, weakness, these things aren't just annoyances. They are signals. They're your body's way of trying to tell you something. The real key is knowing when to stop and just listen.